Table 10.1 Drugs for relief of pain. Generic name dose in mg interval. Comments. Non-narcotic analgesics. Usual dose and intervals. Acetyl salicylic acid 650 PO for every 4 hours. Comments. Enteric coated preparations available. Acetaminophen 650 PO Q4H. Side effects uncommon. Ibuprofen 400 PO Q426H. Comments. Available without prescription. Naproxen dose 250 to 500 PO interval Q12H. Comments. Naproxen is the common NSAID that poses the least cardiovascular risk, but it has a somewhat higher incidence of GI bleeding. Phenoprofen dose 200 PO interval Q4 to 6H. Comments. It is contraindicated in renal disease. Indomethacin dose 25 to 50 PO interval Q8H. Comments. Gastrointestinal side effects common. Ketorolac dose 15 to 60 IM or IV interval Q4 to 6H. Comments. Available for parenteral use. Celecoxib dose 100 to 200 PO interval Q12 to 24H. Used for arthritis. Valdecoxib dose 10 to 20 PO interval Q12 to 24 hours. Comments. Removed from the US market in 2005. Likewise, a generic name parenteral dose in mg, PO dose in mg. Comments. Narcotic analgesics, usual doses and intervals. That is codeine parenteral dose 30 to 60 Q4H and PO dose 30 to 60 Q4H. Comments. Nausea common. Oxycodone parenteral dose none and PO dose is 5 to 10 mg Q4 to 6 hours. Comments. Usually available with acetaminophen or aspirin. Morphine parenteral dose 5 mg Q4H. PO dose 30 mg Q4H. There are no comments. Morphine sustained release parenteral dose none. PO dose 15 to 60 mg BID to TID. And comments. Oral slow release preparation and hydromorphone parenteral dose 1 to 2 mg Q4H. PO dose 2 to 4 mg Q4H. Comments. These are shorter acting than the morphine sulfate. Levorphanol parenteral dose 2 mg Q6 to 8 hours. PO dose 4 mg Q6 to 8 hours. Comments. It is longer acting than the morphine sulfate. It is absorbed well. PO. And methadone parenteral dose 5 to 10 mg Q6 to 8 hours and PO dose 5 to 20 mg Q6 to 8 hours. Comments: due to long half-life, respiratory depression and sedation may persist after analgesic effect subsides. Their therapy should not be initiated with greater than 40 mg per day, and dose escalation should be made no frequently than every 3 days. Meperidine parental dose 50 to 100 mg Q3 to 4 hours. PO dose 300 Q4H 300 mg Q4H. Comments: it is poorly absorbed PO and normeperidine is a toxic metabolite. Routine use of this agent is not recommended. Butorphanol, no parenteral dose. The PO dose 1 to 2 Q4H. Comments: intranasal spray. Fentanyl 20 parenteral dose 25 to 100 micrograms per hour. PO dose nothing. Comments: 70 to hour transdermal patch. And the buprenorphine parenteral dose 5 to 20 microgram per hour. No PO dose. And comments: it is a 7-day transdermal patch. Buprenorphine, that is parenteral dose 0.3 mg Q6 to 8 hours. It is used for comment. It is used for parenteral administration. And tramadol parenteral dose nothing. PO dose 50 to 100 mg Q4 to 6 hours. Comments: it is the mixed opioid or adrenergic action. Now the generic name: upload blockade, 5-hydroxytryptamine or norepinephrine, sedative potency, anticholinergic potency, orthostatic hypotension, cardiac arrhythmia. Average dose milligram per day. Range milligram per day. It is for antidepressants.